Okay, so next I'm going to invite Dr. Brian Rowe to join us. He's the scientific director of the CIHR Institute of Circulatory and Respiratory Health and a professor at University of Alberta.
Is there a clicker? Do I just say next slide? Okay. You're going to advance the slides? Yeah, okay. Thanks very much. So, yeah, thanks very much for the invitation. It's always difficult to follow somebody like Simon, who's got really good stories. And, you know, CIHR doesn't allow us to tell stories. So, and it's taken me 24 hours to get here. So I'll be tired like that guy that was breaking down the Beaver Dam. And I just hope nobody kicks me, because I probably will turn into a rock. So thanks for opening the meeting in a good way, Simon. Traditionally, we acknowledge the land where we are having the meeting. I just like to acknowledge Treaty 6 territory in Edmonton, Alberta, the home of many First Nations and Métis people. That's where Ryan Perry, Helen Coe, and I from the Institute live, work, and play. And we're very grateful for our Indigenous colleagues. We have a long history at CIHR and ICRH and all the institutes of, thank you, of working with Indigenous peoples to improve the health and wellness of our Indigenous colleagues. And I think it's just important to reflect from a CIHR perspective what we've been doing with the Indigenous community, because words are great, but actions are better. And we have invested over $105 million in 15 years in what's called the NEARS program, the Network Environment for Indigenous Health Research. This is the largest capacity development program in the history of CIHR and the history of Indigenous peoples in Canada. We have territorial and provincial NEARS communities in every province and territory except for one, and that is changing this year. And we have a NEARS coordinating center that helps us work collectively across the country. Our commitment was to 4.9% funding at CIHR to Indigenous researchers and people doing research with Indigenous communities. And we have successfully reached that mark this year. And I think that's a major milestone for CIHR. Several years ago, when the meeting with the researchers in Ottawa in 2016 occurred, we developed an iterative review process for Indigenous scholarship, and we committed to the 4.9% investment, and that has been reached. That's not the end of the road, Simon. I want you to know that. We're continuing our work in this field, but that is an example of what CIHR can do when we put a target in place. So I think we're making strides to work in a good way with the Indigenous community and seek true reconciliation. So just for those of you that have perhaps forgotten during the pandemic what CIHR is, it's the Canadian Institutes of Health Research. We have 13 virtual institutes across the country, from coast to coast at least, and these are in the home of the scientific director, the academic home. So I'm at the University of Alberta, and so our institute exists on Treaty 6 territory. And you can see the institutes across the country. I won't name everyone there, but our newest institute director is Angela Kaida, who was a former graduate student of ours at the University of Alberta and has gone on to great things at Simon Fraser University. She's taken over from Kara Tannenbaum. So there is an evolution. Institutes are directed by a scientific director for 4 years, and if we can fool them, we get a second 4 years. And so Kara has served for 8 years, and the other most recent addition is Fifi Liu, a radiation oncologist at Princess Margaret Hospital in Toronto, and she's in charge of cancer research. You'll notice that there are 2 vacancies, so please put in your applications. One was an unfortunate one. It was Dr. Margot Greenwood, who was the interim scientific director for the Institute of Indigenous Peoples Health. And she was, I mean, it's shocking to me, she was recruited by the Ottawa Senators. I thought, well, she likes to walk and she's fit. I don't know, they needed a lot of help. Turns out she is an Ottawa senator now. So when she went to the Senate, she could no longer be the Institute director, and that was a real tragedy for us personally at the Institute, because she's from Treaty 6 territory herself, and her family members live in Edmonton, and we were seeing her a lot, and it was, again, a reflection of our commitment to Indigenous peoples. But we are thankful that she's telling the Prime Minister what to do now, so thank you. Just so that you know, I'm going to be going the way of the dodo bird in about 7 months, 11 days, 14 hours, and 6 minutes. So after 2 terms, they send you the job description, and then they post it. So it's been posted. So anybody in the room that's interested, who wants the job, you know, Helen and Ryan are here. You can chat with them. I'm happy to chat with you. But these are important jobs, and I think there's people in this room that could easily fill this role. So just to start the discussion about EHSI, this quote by Rachel Carlson in the book Silent Spring, "In nature, nothing exists alone." And this is really a reflection of how EHSI was established. So historically, we all know in this room that the physical, social, cultural, and built environments where we work, live, play, and do our regular activities are critical to our health. In Alberta, we've seen lots of wildfires. In Calgary, there were floods. There's recently been ice storms in eastern Canada. The environment is speaking to us, and your lives are dramatically affected by this. And they intersect and contribute to both chronic and new disease. So in 2013, Canada was ranked 15th out of 17 peer countries with respect to environmental performance, got a grade of a C. Now, in my high school, that was a pass. Apparently, that's not going so well anymore, but this would be not a failing grade, but not a good grade. And so the EHSI was established and launched in 2014. Just so that you understand how it works at CIHR, all the open competitions that you apply for, we make no decisions on that. And the institutes are responsible for strategic investments. So if we find a strategic area that needs that has gaps and needs to be filled, we try to fill that. We can't fill all of them because our institute budgets are unchanged since 2000, and our buying power is much less than it was when we started. But that is the goal of the institutes. We launch strategic programs. And so at the time, this was part of the RAF initiative, the Roadmap Accelerated Fund, which is the former strategic plan for CIHR. And we were mandated to use a half of our funding in RAF initiatives. So you've seen some RAF initiatives. One of the ones we ran was the Transitions in Care Initiative. Other ones are like this, the EHSI. So the institutes all got together. Now, we get together all the time anyway, right? We co-fund lots of activities, but that's what EHSI was. And again, it's an intersectional program to understand how environments, genes, and the microbiome interact, and cumulative exposures affect chronic disease and human health. We wanted to leverage and enhance the power of the data platforms in Canada, and Canoe is one of the examples of that. And then we wanted to understand how to prevent and mitigate environmental health threats. And this nexus approach was a strategic approach where urban form, agri-food, and resource development were connected. And so agri-food, the concern was the effects of farming, intensification and practices on antimicrobial resistance. And you'll see we've invested in AMR and so have other global leaders in health. Resource development, community engagement and mitigation strategies to reduce occupational and community exposures to toxins, and then public health and transportation in urban form. Again, intersectional, lots of overlap, and you'll see that in in the reporting. So here were the three main components: environment and measurement, etiology and measurement, data platforms, and prevention. And you can see, I don't know if I can do this. Oops. I'm not very good with a clicker. It doesn't have a pointer, or it does? No? No pointer. Okay, up there. Anyway, you'll see the institutes listed in the various funding opportunities. So my own institute, ICRH, with Institute of Human Development, Child and Youth Health, also referred to as EHSI, I don't know why. That was the data platform. III and Institute of Population Public Health contributed to the intersectional research prevention program. And then environments, genes, and chronic disease were Institute of Aging, Institute of Nutrition, Metabolism, and Diabetes, EHSI again, and III. And then all small amounts were contributed by Institute of Gender and Health and Institute of Indigenous Peoples Health to all three of those activities. And so here's the timeline you can see, and I won't go through this in great detail, but we launched three major initiatives during this period of time. And, I'm not good at math, but it's about $35 million in investment over a 5-year period. When we talk to the NIH, that's like pennies for them, but that's what we've got. And I think these kinds of major initiatives are important contributions. And then you can see also the dreaded coronavirus that started in 2019 in the rest of the world and 2020 in North America. And that's interfered with progress. We'll probably hear some of that, Jeff, over the course of the next 2 days. But you can see that there were three major initiatives here. So environments, genes, and chronic disease, there were 20 letters of intent given a full application. We targeted 8 teams at $400,000 a year for 5 years. That's $2 million for a team. And this is the kind of size of grants that we give at CIHR for teams. Networks are a little bit larger, and smaller sort of emerging networks, we sometimes fund at a little bit less than this. But what you find is when you get CIHR funding, other funding follows, and hopefully we'll hear a little bit about that today. Again, the funding start date was 2015. The end was October 2020. And at the midpoint assessment, progress was being made. There were important linkages in research funding between this group and CNU. There were other grants able to secure additional funds, and several new initiatives were developed. So I think that it has been a success. Obviously, it would be nice to have something to move this to, but you will recall the SPORE grants were the major network grants that CIHR provided. There's only 5 of those, and the NCE was sunset. So the opportunities to build on this have largely evaporated. Then CNU, full application, nearly 4.2 million. Maybe Jeff would say that's 4.1, but we round up. It's one grant over 5 years, and obviously we're here today because of that, and we're very grateful for the team for this midterm or this end of grant report and meeting. This was the opportunity to get together and learn what's worked, what hasn't worked. We know that at the midpoint there were over 200 requests for support, 45 peer-reviewed publications. There were other publications expected, and the platform has expanded and increased the efficiency of doing large data science. And then finally, intersectoral prevention research letters of intent were provided with $25,000 for 9 developmental grants, and full application for $400,000 a year for 5 years. So that's another huge investment. October 2016 was the start, and end of funding September 2021. So highlights at the midpoint were conditions were in place for most of the teams to meet their program objectives. Several teams reported that the research collaborators they established were already influencing policy and practice, and the maturity of and size of the network was influential. So we do a dreaded process pretty much every summer at the institutes called validation. Several of the staff here will sort of twitch with the word validation, but we get all of the funding from CIHR and we say, what is this funding for? So we get the information. We say, well, that's heart, that's lung, that's cancer, that's environment, that's AMR. And then we put it together. And so we've searched the database at CIHR. I think it's very reliable because it's done by the Institute staff routinely with a protocol. And what you see here is at the launch of EHSI, there was growing interest in environment and health research overall. And then it peaked at 2019, 2020. There's been a bit of a downturn as many of these initiatives have been completed. But CIHR's new strategic plan, the 10-year vision for health research in Canada, is like a stamp that you can put on an initiative. And that stamp looks at Indigenous health research and EDI as cross-cutting themes, but also looks at knowledge creation, knowledge mobilization, and capacity development. So those kinds of visions for the future can be stamped on any new initiative. And again, that's what we're looking to do. So what are the current investments? We have added some important investments over the last number of years. We have a Lyme disease network and a food security and climate change in the Canadian North initiative. Healthy Cities is a $43 million initiative looking at the understanding of health promotion within cities. In January, the CRCC launched the International Joint Initiative for Research in Climate Change, Adaptation, and Mitigation. There's money in that, and CIHR is contributing to that. And then we have a small series of grants that the Institute of Population Public Health started last year called the Chief Public Health Officer Funding Opportunity, and we're proposing to do that again this year with the release of the 2023 report. So all that to say, there's definitely more to come. We can't give you a crystal ball and say this is exactly what's going to happen, but this topic, all the work that you're doing is contributing to initiatives that are moving forward and will be announced in the near future. So thank you very much for your time. Look forward to the next 2 days.